Thanks for everybody for coming out today. We have a lot of material we're going to try to get out in a short period of time. I first want to compliment the city of Fall River and their serious reaction to all of our warnings and the things we're trying to tell them to do to keep safe, whether it's social distancing, hand washing, all the common sense things that are needed to push this disease into the rearview mirror, which we are trying desperately hard to do. And we have a great number of partners that are with us here today to give you specific updates on what their organizations are doing. And before we jump to all these great guys up here, we're going to have our two major hospitals in Fall River. I'm going to ask Mike Bushell from St. Anne's to come up first and give you an update of just what's going on at St. Anne's. And we'll keep our social distancing.
Thank you, Mayor Coogan, and all the city health and safety officials, and to our colleagues at South Coast. I am Mike Bushell, president of St. Anne's Hospital, and joining me here today is Candace Vieira, who is a nurse and our director of quality, risk, and infection prevention. At St. Anne's Hospital, we're holding a daily strategy meeting to review the latest information and recommendations being issued by the Federal Center for Disease Control and Massachusetts Department of Public Health. These daily meetings, weekends as well, we have a multidisciplinary team, including chief medical officer, as well as our pulmonologist, critical care medicine, emergency medicine leadership, and leadership from all clinical areas, as well as our supply chain experts. We have implemented the coordination protocols to communicate with public health officials. We have developed an emergency management staffing plan in the case of an escalating outbreak. As part of this, we have trained staff who have volunteered, such as nurses from our pre-post surgery departments, in competencies for critical care nursing and emergency nurses, along with training staff in order to operate in roles to be competent to work as part of our housekeeping teams. In concert with Stewart Healthcare System, we have maintained sufficient supplies of personal protective equipment, such as masks, gloves, gowns, and hand hygiene supplies, and also increased our supplies of ventilators. Since March 14th, we have instituted a no visitor plan and screening process for all outpatient and emergency room patients and any patient escorts prior to entering the hospital to rapidly identify and isolate any suspected COVID-19 patients. For our inpatients, we are providing virtual visits with their family and friends using iPads, if they do not have access to their own smartphones. As part of our emergency management plan, we have identified surge capacity isolation screening, testing, and care areas. Stewart has designated Kearney Hospital in Dorchester as the first COVID-19 hospital in the nation and began accepting positive patients about a week ago from Stewart hospitals. At St. Anne's, we have been working with our emergency medical service on patient transfer process should we need to send somebody from St. Anne's. I am very proud of St. Anne's Hospital medical staff, employees, and our health partners, such as the City of Fall River, EMS, for their collaboration at this challenging time. I know this is affecting all of us in ways none of us had experienced before. I sincerely hope that we don't have too many of these press conferences moving forward. I think we're on the right track. Thank you.
Thank you, St. Anne's. I do want to acknowledge one little program we got going before I turn it over to South Coast Hospitals, Southeast. We have a program called Fall River PPE. It was started by a Fall River nurse. They're collecting protective gear to use in hospitals, gowns, masks, whatever else is necessary. If you see that young lady back at the pylon, she'll give you a thing. But I'd like to turn it over right now to Renee Clark from South Coast Hospitals.
Thank you, Mayor Coogan. So my name is Renee Clark. I'm the Chief Operating Officer for South Coast Health. And just as a brief update, so South Coast Health, we are working with all three of our municipal partners on a regular basis, having calls both to plan, strategize, and try to operationalize our combined resources. Internally, we have 2 command center calls a day, which includes administrative and operational leaders, as well as our physician leadership and nursing leadership that spans the entire health system. We're working closely with our urgent care centers and the main lobbies of our hospitals and the emergency room to make sure we're screening any and every persons that might try to access the system. So whether it's a contractor, a vendor, a patient, you name it, we're screening them. We've also implemented the no visitor policy with very limited exception. That seems to be going quite well. Internally, we do have access for patients that we've screened to do a drive-up testing out at Fonts Corner Road. Again, that's patients that have been screened by us. They meet the criteria for testing, and we're giving them an appointment for that service. In addition, we are looking at all 3 hospitals. We're inventorying every inch of space to see how we might surge and accommodate additional medical, surgical, critical care patients. We're developing that staffing plan that would coincide with that surge, and working closely to make sure that any provider or clinical staff that's not actively busy, now that we've reduced elective surgical cases and are doing most of our outpatient via telehealth, that we know who those providers are and we can deploy them, again, in the event that there's a surge on inpatient volume. Like our partners at St. Anne, we feel as best prepared as we can be at this point. We're watching closely to try to predict what's coming our way, as everyone is, and we will continue to prepare in the best possible way. We have amazing staff and providers, and everybody is fully engaged on working through this with our partners in the community and in the government, and we will continue to keep the community updated via social media and our internet page, where we're posting a number of resource documents. Thank you.
And as I tried to explain earlier, this is a battle for the city of Fall River, and these are our partners. We're on the phone with them at least a minimum of 3 or 4 times a week on conference calls, talking about strategies, whether it's to work with the homeless, whether about patient visits, whatever we deal with, we're including our partners. And we have some other very important partners here with us today. There's a number of them right here. We're going to let a few of them say a few words to you. Our first partner is Kim Smith from the United Way. She wanted to say a few words today also. Kim?
Thank you, Mayor Coogan. He prefaced that by saying I needed to keep it short, and that's really not my modus operandi, but I will do my best. Just to give you an update of how the United Way of Greater Fall River is responding to the efforts, we are continuing to fulfill our obligations to support our agency partners through this crisis so they can emerge on the other side as whole as possible and be able to continue providing the valuable programs and services that support our area's most vulnerable. So first and foremost, we wanted to get that message across that we will continue to support our programs. Additionally, a couple of updates on some of the critical support services that are in place at the moment. Mass 211, by now you have all heard ad nauseum about Mass 211. It is a program of local United Ways across the state. And just 14 days ago on March 13th, Mass 211 was designated by the Massachusetts Department of Public Health and the Massachusetts Emergency Management Association as the official COVID-19 resource and referral line for residents. Since then, it has fielded close to 20,000 calls, climbing this week to just about 2,000 calls per day related to folks seeking information about resources for unemployment, housing, childcare, food, among other concerns. And to put that into perspective, Last year, in 2019, the average number of calls per day was 414, jumping now to 2,000, and we expect that to continue to increase. As a result, Mass 211 has expanded hours and services and is open statewide to callers 24/7, 7 days a week. They've increased staffing to meet the demand, including 2 epidemiologists from DPH to answer health-related questions about COVID-19, such as prevention, symptoms, treatment, information about testing, et cetera, in support of the good work that our hospitals and healthcare providers are doing here. It's easily accessible. Folks can simply just dial 211 from a landline or a cell phone. But as you can imagine, call times are long. There are folks on the other line, operators who are fluent in Spanish, immediately available, and they also have access to more than 150 languages to be able to support everyone in our community through interpreter services, again, 24/7. I should also say, with the increase in volume of callers, folks can access Mass 211 on the web. So we encourage you to push that as an alternative way to communicate through Mass 211 by visiting mass211.org. There's a very easy button right in the center called Find Help. Folks click on that. It brings them to help steps, and it's actually filled with icons, so even folks who have difficulty with English language are able to get through that and get the most updated information. We're encouraging all of our agencies, nonprofit partners, to go in to Mass 211 on a daily basis, hourly if needed, to update their information on Mass 211 so that the operators can give them the most current and appropriate information. In terms of what the United Way is doing with our partners, United Way has launched a help fund or a relief fund called United We Help Greater Fall River, and that is a fund that will specifically go out to support emergency relief and recovery efforts in the Greater Fall River area. We're working also in collaboration with the Community Foundation of Southeastern Massachusetts and my colleague in New Bedford, Michelle at the United Way of Greater New Bedford, to sort of collectively assess and respond to the needs of the community in the most efficient and effective manner possible. Those emergency relief funds will be used to support nonprofit partners, to help individuals who are disproportionately affected by the COVID-19 response, such as the elderly, such as the homeless, those are struggling with food insecurity, students struggling with remote access, et cetera. The list goes on. You can certainly reference our website for additional information. And lastly, I just want to also talk about what the nonprofit community is doing together. United Neighbors and United Way have launched a community think tank called Hey Greater Fall River, Let's Talk on Tuesdays. And it's a Zoom meeting where we're collectively bringing together emergency response efforts so that we can assist our municipality and our local providers to help our residents in the most nimble and safe way. The mission being identifying key agencies who will be able to continue to support and provide essential services. They have the capacity, the willingness, and the capability to do so. Sharing and disseminating information, again, there's a lot of information out there. It's coming at us fast and furious, and we want to be able to make sure that it's the most current and accurate information, not necessarily by social media source, but from providers directly. Mass 211, again, being pushed as the centralized source of getting that information, so agencies are encouraged to update. And then being able to disseminate that, and also to help our community assess and address basic needs in a very safe way, whether that's establishing the food outlets to get the resources to people, and including toiletries, diapers, et cetera, things like that. So that's what we're doing, and we appreciate your help. Visit uwgfr.org for more information. Thank you.
Kim ran through that. I have another announcement I want to make. Glenn Hathaway, who's our Director of Inspectional Services, has told me that his milk and food inspectors have been going out telling restaurants what's expected of them, and now they're going to be moving to a little bit more enforcement. Education piece has gone by the boards. Now it's going to be going to enforcement. They're going to let people know what their expectations are so that everybody in Fall River is eating healthy food and it's safe. Anybody has any specific questions about that afterwards? Glenn standing off to my right. The next person I want to talk before we get into our public safety and education people is Tess Curran. She's our Director of Public Health. I was home last night at 6:45. I called her because I wanted to know what we were talking about for today. and she was just leaving the office. She is a complete grinder. I never knew the girl, but she works extremely hard making sure the people of Fall River are safe, and she is very, very much on point, and she's doing an excellent job for us. And I just wanted to know I really appreciate it, as I'm sure all the citizens in Fall River do. Tess?
Thank you, Mayor. Really what I wanted to talk about today was reiterating the steps that the city has taken, such as closing parks, closing senior centers, and the reasoning behind that. Social distancing is critical to reducing the risk of exposure to individuals, their families, and reducing the burden on our healthcare system. So we all have to work together as a community and have personal responsibility to ensure that we are practicing social distancing. If you're able to stay at home, I would strongly encourage you to do so, particularly if you're in the at-risk population. So seniors only should be going out in the mornings to those early hour grocery store hours, as well as reducing medical appointments to the utmost important visits. This will make an impact. We've seen it throughout other areas of the country and areas of the world. Social distancing is key to reducing the burden on our systems. So I certainly want to encourage our community members to, heed that advice and listen to appropriate news sources, utilizing things like the CDC, Mass Department of Public Health, our city's website, our hospital's websites. Those are places where you should really be relying on information, because that's the most accurate and up-to-date information as possible. At this time, our senior centers will remain closed until May 4th. Again, that's to protect our seniors as much as possible. We're following the governor's guidelines around school closures and following that with our senior centers as well. Government center is closed, will remain closed through April 7th. All of these closures will be reevaluated on a timely basis to make sure that we're protecting our community at large. Again, I'd just like to reiterate that our community partners, as well as city organizations, are working together to try and be as prepared as possible. If you have any questions or concerns, please contact 211. Our health department is also available to field calls. If you have any personal medical questions, I would encourage you to contact your medical provider. And I think that's all I had for today. Thank you.
Another piece of information for you, the Fall River Public Schools, along with Whitson's, our food provider, and Stop and Shop today sent out 70 families their weekly groceries, which is from the food pantry that we initiated this year up at Durfee. So good things are going on. We're still feeding over 4,000 meals a day to kids throughout the city of Fall River. Again, these are not Fall River Public School students in all cases, charter school kids, Catholic school. First come, first served, get a lunch. We want you out there. The next group of people are probably in many ways more important, the most important people in the room. They're the people that keep us safe. And again, they're doing tremendous, tremendous work. My phone is not ringing about anything that any of these gentlemen are doing to help the city of Fall River, and I'll call them up in no particular order. Chief Cullen.
Thank you, Mayor. The Fall River Police Department, we're patrolling the streets like we do all year long. No operational problems. And in some cases, we've had some good investigations that resulted in arrest. And other cases, we have suspects identified, currently looking for them. Our main job is providing support services to the other city departments in the Fall River government. We have a very good working relationship with all the departments, and personally I'm available 24/7 for all the city departments. Whatever their needs are, they send me the request and I take care of it from there. That's all. Thank you.
Our fire chief is John Lynch. He's going to join us and talk about our emergency response and our emergency activities.
Good morning, everyone. I want to reassure the citizens of Fall River that the Fall River Fire Department along with Emergency Medical Services led by Director Tim Oliveira, Emergency Management Agency led by Rick Aguiar, are prepared for this. This is a unique and a challenging crisis, which we all know. But we, as public safety servants, deal with crisis. It's our bread and butter. And while this one is challenging, we are prepared for it, starting with dispatch, through every person on every truck, every medical rescue, right through the people in staff, right through our machine shop who work in our trucks. This is something that we are ready for. I always say that we prepare for the worst, but we hope for the best. And this is a plea. This goes out to the citizens of Fall River. For us to be hopeful for this, we need you to be partners with us to rise this occasion. You have to practice safe distance, social distance, hand washing, staying at home. That will help us out immensely. One other thing I want to say is that rest assured, we are on top of this because we have such a great staff. I want to point out one person in particular. He's not here right now because he's out in the field. He's our infection control officer, Captain Bob Camara. He's one of the reasons that we've been on top of this, and actually we've been ahead of the game of many other communities. So if you see Captain Bob Camara out there, he's the guy that's running around, getting everything in place, staying on top of things, making sure the supplies are here, ordering ahead of time. So with that being said, once again, I want to reassure the citizens of Fall River, you're in good hands, and we'll give you the best product possible. But we need you to help us out. Thank you.
Okay, I'd also like to bring up the gentleman that's steering 10,000 kids through this epidemic, Superintendent of Schools, Matt Malone.
I want to thank the entire city. We got a great team, and Fall River Public Schools is blessed to be part of a city that understands this work. And I have full confidence always in our elected officials and our appointed officials in public safety and health. Fall River Public Schools is handling this crisis, led by our school committee, who is governing extremely well, to make sure that we are chunking periods of time. Right now, as you know, we're closed through April 6th. This week, we've been shut down now through May 4th. We have a 5-paragraph order. I'll list that. In education, we have gone to remote learning. We have work in our online platform called the Continuity of Learning Platform, and packets that families are picking up at meal distribution sites, and that work will continue through April 6th. We are now developing the next level of work that will be from April 7th through May 4th, where hopefully we open again at that time. Also, as part of the education, is taking care of the social emotional needs of kids, and our SACs and guidance counselors are doing a great job. As Mayor Coogan mentioned, they're hand-delivering meals to students in crisis at their homes, students that we know of that need additional support. That's happening on a daily basis. So our education plan is evolving. Follow us on Twitter and Facebook. We're continuing to communicate that out. On terms of meal distribution, as of today, we will have distributed over 30,000 meals in just 9 days. I say again, 30,000 meals in just 9 days. Great partnership with Whitson's, our food service provider, and our own personnel. We have 9 feed sites. Not only are we feeding Fall River Public School students, but we're also feeding the charters, the vocationals, including Diamond and Bristol Plymouth, plus the parochial schools. Any child in the city of Fall River that needs to eat, please come to one of our 9 meal distribution sites. They're on our webpage, and they're on Twitter. We'll continue to feed up through May 4th. That includes our April vacation, which is moved till next week. We will feed every single day, Monday through Friday, 11:30 to 1:30, up through May 4th at this time. Operations, Ken and his team, not only leading food distribution, but we're also cleaning 17 buildings. Ken's team has cleaned 2 million square feet of facilities so far, and will continue to clean. Once buildings are clean, we shut them down, they are closed, and no one comes in. We'll maintain those operations again through May 4th. Compensation, up through April 6th, we've kept whole under the school committee's leadership, all of our full-time employees, but there are expectations and they are working as well. So it's work from home. We've gone to a modified schedule, modified staffing. We're operating under essential, critical essential employees only. But everyone else is being paid under the guidelines by the federal and state government and working with us on MOUs of what those agreements for the work. Teachers are working. Our SACs and administrators are working. They're working with kids every single day. Most of it's electronic. Some of it's through the phone. But they are working to support children. And then finally, communications. We're communicating every single day. This is a great way for us to continue. I, too, want to say Tess has done an amazing job of keeping us informed on the health side, and Mayor Coogan's entire team. I can't say enough positive things about how great the city is rallied around to meet the needs of kids, adults, and residents. So with that, I want to Unsung Hero Award, Ken Pacheco, Chief Operating Officer, carries the weight of the world on his back, and he and I are out there every single day, and a true partner. I couldn't do anything or be anybody without Ken's support. So thank you, Ken, and thank you, Mayor's team.
And in conclusion, I know you've got a lot of information. I just want the public to know that Fall River right now is working 24/7 to make sure our residents are safe. The team up here is organized, prepared, and they are not afraid of hard work, which is what this is going to take. Our partners in the hospitals, our partners at the United Way, everybody's pitching in to make sure we get through this with the minimum amount of disruption, although it does seem like a lot. Believe it or not, it's the minimum compared to other places. We're going to work hard. We're going to defeat this pandemic, and Fall River is going to come out the other side much better for it. I appreciate everyone coming out today, and thanks for coming by. Any questions? Michael and then Keith.
This is for the police chief. Do all the officers have enough masks and gloves when they're responding to calls?
Yes, we have sufficient supplies, and we network with the city EMS, and as we need extra supplies, we've been getting them, and there's no danger zones right now. As we say, we have sufficient to get through each day. And as of now, we don't anticipate any problem. We have the city EMA director, Rick Aguiar. He's looking for supplies from the state agencies as well. So for our police, we have sufficient supplies for all personnel on the front lines. That's always been my priority one, support for the men and women on the front lines. That stopped yesterday afternoon. We made an arrest. There'll be a release coming out later. And 14 breaks were linked into one person alone. 2 arrests were made.
Yeah, I just have a question about, for you, Mayor, or Tess. Yesterday it was reported that the city has 3 cases. Has that number gone up? Are we still at 3?
The desk can come over and fall on the sword for this one. Go ahead, Todd.
I received direction from the Department of Public Health today that individual cities should not be releasing any case count numbers. So at this point in time, we'll be relying on the state to provide information on county-wide data, and we'll have to rely on that information. So at this point, based on yesterday's numbers, there was 90 cases of COVID-19 in Bristol County as of yesterday. And the State Department of Public Health updates their website around 4 p.m. daily with that information. Okay.
And that's all at mass.gov, so don't be afraid. We go in there every day at 4:30 to get the count. Anything further for anybody else? Again, thank you.